mynews.studio.
A village, once blinded by trachoma, now sees sunlight. Could we be witnessing the end of an ancient disease?
Today is February 1st, 2026. For the first time, fewer than 100 million people worldwide need treatment for trachoma, which is still the leading infectious cause of blindness. That's according to the World Health Organization. The number is now about 97.1 million people. That's actually a 94% drop since 2002.
That's a huge shift, and it didn't just happen on its own. The progress comes down to the safe strategy, surgery, antibiotics, facial cleanliness, and environmental improvement. It's a bundle of interventions. Countries like Burundi, Egypt, and Senegal have put this into action with results. But why did this particular set of strategies work so well across such different places?
Part of it is scale and coordination. Over 1.1 billion doses of azithromycin, donated by Pfizer, have been distributed through the International Trachoma Initiative. That's a huge number. Plus, there's education around facial cleanliness and work to improve water and sanitation. So it's not just one approach. Isn't this a kind of template for tackling other neglected diseases?
It is. And what stands out is how adaptable it's been. Even though trachoma is still a public health problem in 30 countries, the World Health Organization has already validated 27 countries as having eliminated it as a public health problem. At least one country in every region where trachoma is endemic has hit that milestone. Does that suggest coordinated health strategies can really work globally, even in such different settings?
The evidence points in that direction. But let's talk about the data. The Global Trachoma Mapping Project, which ran from 2012 to 2016, is worth mentioning. It was the largest infectious disease survey ever done. They surveyed 2.6 million people across 29 countries using smartphones to collect the data. That meant resources could be targeted very precisely. How important was this move to data-driven decisions?
It was critical. Without that kind of data, interventions might have missed the people most at risk. And it's not just a one-off. The methodology continues today with the Tropical Data Initiative, which has supported more than 4,000 surveys, covering over 13 million people in 55 countries. Is this what public health will look like in the future? Big data guiding every step?
There's a strong argument for that. Of course, even with all this progress, challenges remain. Right now, almost $300 million is needed for the final push. Things like surgeries, antibiotics, more surveys, and ongoing research. Ethiopia is a key case, isn't it?
Yes. Ethiopia actually accounts for 64% of the global trachoma burden. But last year, it also delivered 72% of all global trichiasis surgeries and 73% of all antibiotic treatments. That's a serious national effort. Why is Ethiopia's progress so central to the global elimination goal?
Because if Ethiopia succeeds, global numbers will drop sharply. The strategies there are mass drug administration, building surgical capacity, and improving water and sanitation. International partners are focusing resources on Ethiopia. But how about the most vulnerable groups? Are gender disparities being tackled?
They are. Last year, 52% of the 44.4 million people treated with antibiotics were female. That reflects a deliberate effort to make sure women and girls aren't left behind. And collecting gender-specific data helps track and fix gaps. Could this approach be useful for other health interventions?
It should be. Tracking who receives treatment and closing those gaps is a lesson for any health campaign. And coming back to the data, the Trachoma Mapping Project is like a playbook for fighting other neglected tropical diseases. Systematic, tech-driven surveys just make interventions more efficient. Shouldn't more global campaigns be following this model?
Absolutely. This is bigger than just trachoma. It shows what's possible when you combine global coordination, funding, and grassroots action. As we face new health threats, what are the main lessons here?
Sustained investment, international cooperation, and community involvement. The near elimination of trachoma proves that even major problems can be solved.
Today, we've looked at how the fight against trachoma is changing global health. Data, partnerships, and targeted strategies are making real progress.
And as trachoma nears elimination, it's setting an example for tackling other neglected diseases. Thanks for listening. This episode was powered by mynews.studio. Try it now for free.